Hello, this is Dr. Atta. I wanted to talk about treatment options for social anxiety or what's available nowadays, and briefly talk about the different options available. So, number one is, depending on how we understand the social anxiety, the different schools of thoughts give different solutions. So if the problem is here, the solution is that. If the problem is here, the solution is that. So let me briefly overview. The first one I was already mentioning is the biological model, in which we are treating the people with medications mostly. There are also sometimes procedures such as ECT, rarely used, or transmagnetic stimulation, but that's rarely used in anxiety, but they're available. And the concept of medication is that we are addressing the transmitter imbalance that is available in the body, and depending on what medications we use, the effect is such. So like I was talking before, if we are defining social anxiety as deficiency of serotonin, we are trying to increase the serotonin level through typically newest antidepressants, which is selective serotonin reuptake inhibitors, SSRIs, things like Lexapro, Celexa, Zoloft, Prozac, Paxil, Luvox. I think the newest one is Vibrid, and Brintellix. There are plenty of medications in that category, and all they similarly do, they block the destruction of the serotonin in the and while they are in between the axon nervous system axons. And this way they increase the availability of serotonin, and that's supposed to decrease our anxiety. How effective they are, I would just say from my personal experience, clinical experience, they are mildly effective. They are usually best used for panic disorder and general anxiety disorder, not as effective in social anxiety disorder. There are other medications that are a little bit more effective in the group of antidepressants. However, they are rarely used, and the reason is they are considered very dangerous. From what I understand, because even I use them quite rarely, the most effective medication for social anxiety from the antidepressants is MAOIs. So these are one of the older antidepressants. The problem with them is that if you use them, you have to be very careful about the diet, because there are certain things that you are not able to eat, and you have to be very particular about it, because if you eat them, you may end up having a serotonin syndrome. Basically, you have a so-called tyramine crisis. Your blood pressure goes up, and the biggest problem with those medications is that it's kind of irreversible. So there is no antidote to fix this. You can potentially die. Practically, that doesn't happen. However, that's warning is good enough that almost anybody prescribes that medication nowadays. So it's very rare. So it's really even hard for me to say, based on my personal experience, if it's very effective. I only hear it anecdotally from some of my colleagues who have used it, who are using it frequently. More frequently, I would say that it's very effective. I personally never seen it because I've never used it for that particular reason. But SSRIs are fairly effective. They help. They do not solve the problems, but they help a little bit. Now, the biggest problem with that is that they have side effects, and like I mentioned before, the biggest one is the sexual side effect, and it causes the decreased drive, and especially prolonged ejaculation. Sometimes it's impossible to ejaculate. Therefore, it's a big problem for majority of men. The other pharmacological solution is benzodiazepines. They are medications that work on GABA A neurotransmitter receptor, and basically increase the amount of GABA in your body. That is definitely effective. The only problem with that is that the chronic use and long-term use creates more problems than benefits in the long-term use, because it's quite for the practical purposes, it's similar to drinking small amounts of alcohol every day. And what happens, as we know, if somebody drinks small amounts of alcohol every day, at some point it's not going to be good. So after 6 months or a year of taking those small amounts of substance that is a little bit like alcohol, bad things happen. We are dependent on them. It's very difficult to function without them, and there are plenty of negatives. The other solution to social anxiety is psychodynamic therapy, and that focuses on the trauma that we experienced that caused us to be socially anxious, either something traumatic with our parents or people close to us. There's this joke that it's all comes back to the mother, possibly some traumatic event including our mother, and figuring out what it was and understanding that reason kind of gives us that breakthrough and understanding, and now we are free of the social anxiety. Practically, from my experience, again, I don't want to talk with certainty, but from what I've observed, psychodynamic therapy is not very effective for social anxiety. I have seen plenty of patients with prolonged psychodynamic therapy experience. That's thankfully I live and I work near New York City, so there are plenty of psychodynamic therapists, and there are plenty of patients still who underwent extensive psychodynamic therapy. But my experience has been that it can be effective for a variety of reasons, but not for social anxiety. And my explanation for why that is that you are in a separate, confined space with a therapist who is quite non-intrusive. So it's a very artificial experience that is extremely comfortable, but nevertheless artificial. So whatever happens inside the therapist's office does not correlate well with our experience on the outside world. So even if we talk forever about the causes of why we are afraid to fly the plane, we can talk about it for 20 years and understand that the reason why we're afraid is because when we are 5 years old, we saw an article in which there was a very nasty picture of somebody dead in a wreckage of just recently destroyed plane. That understanding, even talking about it for 20 years, will not help us when we're actually supposed to load the plane, because the experience of talking does not necessarily transform into the experience of being or experiencing the event. That's at least my argument against the psychodynamic therapy for social anxiety. In my experience, it actually kind of either is neutral or if anything, it's detrimental. The other therapy available for treatment is cognitive behavior therapy, and that is a therapy created by psychiatrist Dr. Aaron Beck. I believe he started in the 70s. He's still alive. He's, I believe, in his 90s, and he's very active still. And he postulates that the causes of the social anxiety or any other mental disorder such as depression, even schizophrenia, doesn't matter. What matters is the approach to treatment. And it stemmed from his frustration. The reason why he came up with this therapy, it exactly stemmed from this frustration of psychodynamic therapy not being really effective for depression or anxiety. And so he created a system in which there's manualized therapy that focuses on the idea of grasping those irrational thoughts and creating that triad of irrational thought, irrational behavior, irrational emotion, and the idea is to break that cycle. And you do it through through interactions with therapists. You do it through the homework, and then you do it through exercises that you're supposed to do in the real world. And in principle, it's a very good idea, and very often this is effective therapy. The negative of that solution, in my view, is that too much of it is focused on the inside the office of the therapist. That's my experience, at least from what I've seen. If there are different examples, I'll be happy to see them, and I'm very interested in that. But that's the limitation, that eventually when you have to face the real world, again, transition is not that easy. Because one thing is to talk to the therapist about blocking automatic thoughts and things that we are supposed to do. One thing is doing your homework about it, but doing the actual homework of actual interaction in which you challenge yourself is very difficult to accomplish on your own. Okay? And then part of the cognitive behavior therapy is exposure therapy. And that is a situation in which you actually go, regardless of the cause of the, you go and you challenge yourself to the conditions of that you fear the most. And there are different ways of doing that. You can do it through gradual exposure or sudden exposure. It's called the gradual exposure versus flooding. But the idea is that you facing the fearful issue kind of gives you recovery. And again, it's a very good idea in principle. The problem is that it's not so easy to do, because if you are supposed to do it on your own, it's extremely challenging. So you have to create a situation in which you are kind of forced to do, and then once you do it once, you have to repeat it over and over again. My belief is that it's the most successful method of treating that social anxiety. However, in my view, it has to be in combination with additional elements, such as induction into that state that will allow you to go to the exposure therapy, and that's where I believe is the role of medications. Again, these are all alternative solutions to the same problem, but in terms of my personal opinion, I believe that the combination of medication that induces the state that will allow you to go to the exposure and repeated exposure to the stressor is the most effective long-term solution. The negative of that solution is that it's complicated to do, okay, it's difficult to do, and it requires effort and commitment, because there are moments in which it's challenging. It's not as easy as sitting in the office with the therapist and talking about your childhood. It's sometimes uncomfortable, sometimes difficult, but if you go through the stages of that experience, I believe it could be extremely therapeutic for people suffering from social anxiety. So that would be my 2 cents on the topic of treatment of social anxiety. And thank you.